Hi, everyone. Welcome back to Research Updates again. I am so pleased to be here with you. I am here every first and third Thursday talking about research updates that have to do with lipedema. I'm so happy to be here with you today. Again, I think I had to miss before because of all the activities were happening in October. I was out of town myself, giving several presentations. So it's been a busy time, but a lot of exciting things happening with lipedema. And so we get together the first and third Thursday to talk about things that are of relevance to lipedema, different papers and research projects that have come up. And so I think I got a really good one for you here today. And I was just working on another paper that I want to use for next time that I think you'll also find fascinating. So today's paper, it is a review paper that was in a collaboration between two universities, researchers that were at Vanderbilt and also some researchers at Texas A&M. And two authors that you might recognize on this particular paper are Rochelle Crescenzi and Joseph Rutkowski. These two people have done a tremendous amount of research in lymphatic and fat disorders, had lots of papers out. So this is just another one of them. So this particular paper that they are on is called Current Mechanistic Understandings of Lymphedema and Lipedema, Tales of Fluid, Fat, and Fibrosis. Just a really great bringing together a bunch of information about these two disorders and coalescing them in a new way that came up with new insights. I think you'll find this fascinating. It was in the International Journal of Molecular Sciences in June of 2022 is where you can find it. We'll also have a link here. It'll take you straight to the paper. I do believe this is open access. So if you follow that link, you can get the paper yourself. If you have any trouble at all, just feel free to email me and I will send you the paper. So the aim of this paper was to discuss, compare, and contrast the distinct clinical characteristics, symptoms, pathophysiology, and potential genetic markers of lymphedema and lipedema. And so the authors were hoping that this would inform other researchers about directions that they could take on researching these conditions. So first they were looking at what are the clinical criteria for criteria and symptoms of lipedema and lymphedema. And interestingly, the authors came up with, after reviewing the literature, that there's a lot of overlap between these two conditions, which may be one reason why it's difficult sometimes to come up with a diagnosis. And so both have stages. So we have the stages of lipedema and we have stages of lymphedema, and those stages show a progression in severity. So, and both of them have the symptoms that include fluid, fat, and fibrosis, hence the title of the article. But the appearance or when these symptoms show up is in different times in the course of the condition. So for instance, fluid is prominent in the early stages of lymphedema, whereas in lipedema, fat is present in those early stages. And then they also talked about that there are some distinct features of lipedema that just are not found in lymphedema. And one is the easy bruising that we talk about a lot, joint hypermobility. And this is not in every person with lipedema, but a lot of women with lipedema have that joint hypermobility. And then also the pain aspect is generally only appears in lipedema, although you can have pain also with lymphedema. Also, lymphedema appears equally in men and women, or boys and girls. And it usually is due to a hereditary cause, or it's usually due to treatment for cancer. So those are the most common reasons. I would say, though, really, to be accurate, the most common reason for lymphedema worldwide is a parasitic infection that you get in tropical and subtropical regions. So that's not totally accurate. But Lymphedema appears equally in men and women. And in lipedema, as we know, it's pretty much almost exclusively in females. And it seems to coincide with those hormonal times in a woman's life. So puberty, pregnancy, and menopause. So next they looked at what they called molecular regulators and pathophysiology. So pretty much they were looking at the physiology of the disease process in the tissues of lipedema and lymphedema. And one thing that they said is that this process, this physiological process, is much less well understood for lipedema than it is for lymphedema. We know that we have this certain cascade of events that seems to happen, but we don't know what the actual trigger is. What starts it off for lipedema? So the triggers in lymphedema are pretty well identified. There is usually, if it's a hereditary impairment of the lymphatics, we usually can identify a gene, and even though it may not present itself at birth, it can present itself later in life, usually by puberty, but you can identify that gene. Whereas, and if it's secondary lymphedema, you can identify some kind of trauma, cancer treatment, or some other surgery or something that gave you that lymphedema. And all the other very prominent reason for lymphedema is just a fluid overload. And so we can identify that we have organ failure, we have obesity, we have venous disease, and then that gave you lymphedema. So really they tend to be able to identify those triggers, but we can identify lipedema once it's present, but we're still trying to figure out what is the specific trigger. How does this actually happen molecularly? And so then they discussed how both conditions, as I said, end up with a combination of fluid, fat, and fibrosis. But the origin of that fluid and fat accumulation in lipedema, we're just not entirely sure about. Both lipedema and lymphedema have signs of chronic inflammation. We know we talk about that a lot for lipedema, that inflammation seems to be key for the pain and other symptoms that we see. And so, the blood markers that show that you have inflammation or a chronic inflammation or a chronic immune response in your body they're usually much more elevated in lymphedema than in lipedema. So this is another area that the author said this should guide our research. We need to figure out what is happening with the inflammatory response, the immune response in lipedema, and get a more clear understanding of that. So then they came up with this really interesting hypothesis, and they were talking about how the pathophysiological changes that occur in both lipedema and lymphedema are similar, but they actually occur in different directions. So lymphedema starts, as I was saying earlier, with a fluid problem. And then that leads to chronic inflammation. And that chronic inflammation leads to an excessive fat deposition in the area of the fluid accumulation. And the lipedema, on the other hand, starts the other direction. It starts with an excessive fat deposition of the trigger we don't know. But you have that excessive fat deposition that leads to chronic inflammation and fibrosis, which then leads to excessive fluid deposition or swelling. So they both end up with this tissue combination of fluid, fat, and fibrosis. They just come at it from different directions. So I've never seen it written that way before, this article. So I thought that's a very interesting hypothesis that we should test. Then they talked about genetic causes and other indicators like blood value indicators, stuff like that, that may help us identify a condition. And the genetic mutations and causes are much more clear, as I was saying, for lymphedema. So we have some confirmed genes that lead to particular varieties of lymphedema. We know this. And what's really important about knowing that is that we know if you have this type of lymphedema, you might also have a propensity for these other comorbidities. And so we know to look for those and monitor you for that. When we've identified that you have this particular type of lymphedema, what we need is to be able to also do that for lipedema, so that we know that, oh, this type of lipedema has a propensity to have also hypothyroidism or Ehlers-Danlos syndrome or something. And then we know to monitor you and deal with those conditions, hopefully maybe even prevent or somehow lessen the impact of those conditions, because we know that those could happen, but we don't have that yet. So we have those genes for lymphedema, but not for lipedema. But they did point out that they only have been able to identify in the world of people who have primary hereditary lymphedema, which is actually rare, but the world of people that have this hereditary lymphedema, they only have been able to identify about a third of them have an identified gene that has been mutated and gives them a particular variety. So it's still not so good even for lymphedema, but at least a third of them know the type of lymphedema they have and what their genetic mutation is. We don't have that at all for lipedema. But there has been, in the last, I would say 10 years, a lot of research has been devoted to trying to find genetic markers for lipedema. So there's a lot out there. We've made promising progress, but we still have not definitively identified that. And right now, what they're doing is, if you do have genetic studies done on yourself, it's usually just to rule out that, oh, you also have this hereditary form of lymphedema or some other condition. It's not to identify your lipedema, but to rule out other conditions that you might also have. So, and then lastly, the authors made a call for further research. Of course, we always need more research on this topic. And so here are some things that they suggested that we look at. To what extent is lipedema a lymphatic disease? So one of the papers that was out there about indicators of lipedema was about PF4, platelet factor 4, which is a blood marker that shows that you have a lymphatic disorder, and it's elevated in women with lipedema. So is there other indications or proof that lipedema is a lymphatic disorder? We should do some more on that. What do we have to say that lipedema is a connective tissue disorder? We need more research in that direction. What about what causes lipedema pain? And not every person with lipedema has pain, but many women do. And so what is the mechanism for that? There's a lot of hypotheses out there, that a lot of promising ideas about why that occurs, but we simply don't know for sure. And then going back to the genetics, they want to know which genetic pathways can cause the characteristics of lipedema. So I find this paper fascinating, and I do believe it is super important for the lipedema population, because it really gives a good explanation of all the symptoms and characteristics and mechanisms, possible mechanisms that are involved in lymphedema and lipedema. I especially liked how they talked about that development, going from different directions, fluid to inflammation and fibrosis, and then to fat, versus fat going to inflammation and fibrosis and going to fluid. That was fascinating. And then further research that could help us more accurately diagnose lipedema sooner and get you into the proper treatment sooner, super important. And the authors do believe that looking at this, exploring this more, is going to help us do that, to give better treatment and improve the quality of life. I see a question posted here. How does this opposite direction of occurrence, how does it tie into lipolymphedema? Well, and so when you have later stages of lipedema and you start getting that fluid accumulation, meaning now you have lymphedema on top of your lipedema, but you started out with just lipedema. That is exactly what they're talking about. Is you start out with that fat deposition, and then you got the excessive fat became inflamed, chronically inflamed. You developed fibrosis in the tissue, and this led to that accumulation of fluid that then became chronic, and then that is lymphedema. So that is exactly that. It exemplifies that direction, how that progresses. Thank you for those of you that are posting here. I'm glad to have you here. I like to know that I'm not here alone talking to you. Hi, Julie. So yes, you'll catch the replay later. Wonderful. Hi, Dawn. And you said, is that why my ankles are crazy? I'm assuming that, getting that fluid accumulation where your ankles start puffing, especially at the end of the day, and then sometimes they don't go down, they kind of stay puffy. Yes, that's a progression where that fat then led to that inflammation and fibrosis, and now you get the fluid accumulating. And there's Michelle from Rhode Island, and Liza. How does this opposite direction of occurrence tie to, okay, I already answered that one. Marilyn, I am focused on lipedema. I have RA, which is rheumatoid arthritis, and I'm on estrogen blocking cancer pills. Where do I go for a diagnosis? Yes. And so, Marilyn, I would like to suggest that you go to our website, lipedemaproject.org, and there is a provider directory. You can consult there for someone in your area. Unfortunately, there is not someone in all areas, and you might have to travel. The other thing you can do is definitely start with your own healthcare provider, because if you're lucky enough, they might have heard of and understand lipedema. They might be able to give you the diagnosis. This can be a wonderful opportunity for you to educate your healthcare provider, and if they're open to it, maybe they'll be willing to look into it more, and you can get a diagnosis with someone you already have as a healthcare provider. But we do on our provider directory, it has mostly in the United States, but you can look at providers there, and unfortunately, like I say, may have to travel. And we have someone here from Los Angeles. Hello, great to see you. Thank you very much. And Dawn, I merely wash my dishes and my legs will swell up. Yes, that sometimes I've heard of people, taking off their compression garments long enough to take a shower, and they're standing in the shower and they can feel the fluid starting to collect because of gravity. It happens that quickly. I know that some people are super sensitive that way. And so if we can find a way to interrupt that inflammation and fibrosis, we can do something about that swelling. This type of research and these type of papers can help inform our healthcare providers on how they can help us. And that is, Dawn was also talking about cellulitis and recurrent cellulitis. And once you get lymphedema or chronic swelling, then you have a higher propensity for getting infections like cellulitis because of that inflammation that affects your immune functions. So controlling it, treating the symptoms as best you can is going to reduce your incidence of infection. I can't say that it's going to totally remove you from ever getting an infection again, but it definitely should reduce the frequency and hopefully the intensity of the infections. So, wow, thank you guys. Lots of great comments. I will be, like I say, doing another paper. This one was recommended to me, and I do take your suggestions. And so this next paper I'll be doing next week is talking about how lipedema symptoms also seem to mimic pregnancy. So I think it's going to be a very interesting paper to talk about. One other thing I wanted to make sure you all knew, if you know about our lipedema tribe, a wonderful support group with all kinds of resources and interaction and courses and all kinds of stuff for women with lipedema. That the membership to that tribe closes today. This is the last chance you have to sign up. That's done today, and then it won't open up again until, I believe, typically it's during Lipedema Awareness Month in June of next year. So don't miss this opportunity. If you want to learn more about the tribe and all the things that it offers and all the tremendous support, check the links here and check that out. Find out more about it, because this is your last opportunity until sometime next year. So that is all for today, but I look forward to being with you again on the third Thursday of November. And actually, I will be at the National Lymphedema Network conference being held in Cleveland this year. So I'm going to be coming to you from my hotel room at the conference when I talk to you about this paper about lipedema and pregnancy. So thanks for being here, and I'll see you again next time.